Hi Neet Aspirants, welcome to Vari Medical Academy. Vari Medical Academy சார்பாக அனைத்து விதமான டாபிக் சார்ந்த ஒவ்வொரு வீடியோவும் இனி வரும் நாட்களில் உங்களுக்கு வரும். உங்களுக்கு இதை சார்ந்த சந்தேகங்கள், கேள்விகள் எதுவாக இருந்தாலும் கமெண்ட்ஸில் பாஸ் பண்ணுங்கள். எங்கள் எக்ஸ்பர்ட் ஃபேக்கல்ட்டி மெம்பர்ஸ் போடுற வீடியோஸ் பிடிச்சிருந்ததுன்னா ஷேர் பண்ணிக்கோங்க. அந்த வீடியோ ரெகுலராக உங்களுக்கு வரணும்னா சேனலை சப்ஸ்கிரைப் பண்ணிக்கோங்க. தேங்க்யூ. wish you all the best.
So last class we see about digestive systems. Okay, so up to the mouth. Now we start with the next part is a buccal cavity. The next part is called as a buccal cavity. Okay, the buccal cavity, it is all called as a oral cavity. It is called as a oral cavity. Okay, so here it starts from here, this part. Okay, this part, it's a buccal cavity part. It has, that is a pharynx, that has a pharynx. Okay, that's a pharynx. Here the three types of pharynx. One is for laryngopharynx and usopharynx. Okay, usopharynx and nasopharynx, and then a nasopharynx. Okay, laryngo, uso and nasopharynx. So here and also here is a cartilaginous tissue is a big glottis. Have a glottis. It is has for a glottis. This glottis have, it is for a prevention of the air particles into the food pipe and a prevention of food particles into the air pipe, and is a ploughing movement. They have the. Okay, now we start with the buccal cavity. Okay, buccal cavity is otherwise called what? The oral cavity. Okay, otherwise called as a oral cavity. So it starts from here. It starts from this part. Okay, this part. This is having for a glottis tissue. They have a glottis tissue. Glottis. This glottis can be used. A glottis. Okay, glottis. This glottis can be emitted. It is for it projected. Okay, it is used for is prevent the entry of food particles into air passage. Okay, then the air cannot be entered. Okay, can be entered into the food passage during swallowing. Okay, so that's called as a epiglottis. It is called as an epiglottis. Okay, epiglottis. Okay, so here the pharynx is there. This is a pharynx. Okay, pharynx is there. So the pharynx has three types. One is a laryngopharynx, then usopharynx, then the next one is a nasopharynx. As a laryngopharynx is found the palatines, then nasopharynx is found in the our upper palatine region, then usopharynx is near the esophagus. Okay, so it can used for there is a enter the food particles. Then the next one we can see that esophagus. Okay, the esophagus, it is a long and narrow tube. Okay, so here the food can be entered into the esophagus in the form of bolus. Okay, so here the food can be entered into the peristaltis wave movement, in the peristaltis wave movement. So how that move? So it is a food pipe, you know that. Okay, so the food can enter here and bulging here this place, then after that here. So that's movement, that kind of movement is called peristaltis. Okay, peristaltis. For example, so here it is a food molecules. It's enter here, then close and open and close and open. Okay, so this movement is called as a peristaltic movements. Okay, so then when enter into the stomach, the food can enter into the stomach. It's the end point of esophagus. It joined to the stomach. Here this one sphincter is there. That sphincter is called as a cardiac sphincter. Okay, cardiac sphincter. Okay, the sphincter is called as a cardiac sphincter. Okay, that's called as a cardiac sphincter. And okay, the histology of alimentary canal. The next one is histology of alimentary canal. Okay, the histology of alimentary canal. So we can take the cross section of esophagus. The cross section of esophagus, okay, its outer layer, it's called as a serosa. Okay, then behind the serosa, the muscularis externa. The muscularis externa. Okay, it has inner and outer layers. Inner and outer layer. Okay, it has a inner circular, okay, and outer longitudinal layer. Okay, and behind this muscularis externa, they have the soft mucosa. They have the soft submucosa. It is a submucosa layer. Okay, then inside they called is a mucus layer. That called as a mucus. That called as a mucus layer. Okay, so it is a lumen. Okay, it is called as a lumen. Okay, and so these are the histology of alimentary canal. These are the histology of alimentary canal. And the next, it is enter into the stomach. You know that, okay, the esophagus enter into the stomach. The esophagus enter into the stomach. Okay, the stomach, it is a J-shaped back-like structure. It is. Okay, it is a J-shaped sac-like structure. That like, okay, it's J-shaped like. So it is a cardiac region. So it is a cardiac. Then it is a fundus. Then here the pyrolic. Okay, it is a pyrolic region. Okay, so it is a sphincter. Sphincter means what? It is a thasai surukam. Okay, so here the cardiac sphincter is present, and in between this starting of ending of stomach and starting of the duodenum, starting of the duodenal region, they called as a pyrolic sphincter. They called as a pyloric sphincter. Pyloric sphincter is there. Okay, so pyloric sphincter, so it can be prevent. Here cardiac sphincter can be prevent is backflow enter into the esophagus, but here it is pyloric sphincter has been used for the backflow of prevent by his stomach. எங்க டியோடினத்துக்கு வந்த ஃபுட் மேலே மறுபடியும் ஏறாம இருக்கிறதுக்கு இங்க தடுக்குது. So this is duct. Okay, then here this muscular. Okay, it is a fundus is a main body of stomach. Okay, main body of a stomach. Okay, so and here you have the paratite cells will be present. They secrete the HCl. They secrete the HCl. Secrete the hydrochloric acid in highly acidic condition. Highly acidic condition. Okay, highly acidic condition. So that acid means it is a 1.8 pH. Okay, it is a 1.8 pH. 1.8 pH. Okay, the highly acidic. So inside this paratite cells and oxalic cells, the oxalic cells of the muscle body. That is oxalic cells. Okay, they are produced the hydrochloric acid. Oxalic cells will produce the hydrochloric acid. Okay, paratite cells, they called as a paratite cells. Paratite cells. Okay, the stomach region. Okay, it's a stomach. Then here the starting of digestion. The starting of the digestion mixed with the swallowing. Okay, and here it is called as that movement, a charming movement of the food material. Okay, the movement of charming. Here it is a clockwise and anti-clockwise movement of the food molecules. They called as a charming movement by a stomach muscular nature. Okay, charming movements. Okay, so these are anatomy of stomach. Anatomy of stomach. Okay, yes, thank you.